Thank you so much for joining us for our next pet parent webinar in the PetSure Paws Learn series. I'm Danny Houlihan, Chief Veterinary Officer at PetSure, and I'm your host and moderator for today's session. Today's webinar on the 12 perils for pets at Christmas is brought to you by PetSure and Dr. Claire Sharp. As a reminder, any advice is general only and is not considered your personal circumstances, so may not be right for you. Cover is subject to the policy terms and conditions. You should consider the relevant product disclosure statement or policy wording available from the relevant provider to decide if a product is right for you. Insurance products are issued by the Hollard Insurance Company and administered by PetSure Australia through our Authorised Representatives and our distribution partners. PetSure is a company of animal lovers, providing a sense of security to pet parents through pet insurance. PetSure powers the pet insurance propositions of many well-known brands, including Woolworths, RSPCA, Bow Wow Meow, Pet Insurance Australia, and many others. Additionally, PetSure has transformed the claim experience with the development of Gap Only. If you'd like to find out more about PetSure or Gap Only, please visit our website. Before I begin, I'd like to run you through some housekeeping items. The webinar will run for approximately 40 minutes, followed by a 10 to 15 minute question and answer session. On the screen, you should see a control panel to your right. If you experience any problems during the webinar, please submit your issue within the question panel and we'll try and resolve it for you. During the webinar, all phone lines will be muted to reduce background noise. If you have a question for Claire, please post your question in the question panel. The speaker for tonight's webinar is Dr. Claire Sharp. Claire is a small animal emergency and critical care specialist working at the Animal Hospital in Murdoch, Perth, Western Australia. After graduating from vet school at Murdoch University, Claire pursued her specialty training in the US, becoming a diplomat of the American College of Veterinary Emergency and Critical Care in 2010. Claire's current position includes looking after sick dogs and cats in the animal hospital, training the next generation of emergency specialists, teaching veterinary students, and doing research in emergency and critical care. So without any further delay, I'd like to hand you over to Claire.
Thanks so much, Danny, for that introduction. And I'm excited to be here today to talk about the 12 perils of pets at Christmas. So this is a little bit of a take on the 12 days of Christmas, but with a little bit more of a veterinary medical bent. So I'd like to start with an acknowledgement of country. I am here in Perth, Western Australia, and at Murdoch University on the lands of the Whadjuk Noongar people. And I would like to pay respect to their enduring and dynamic culture and the leader of Noongar elders, both past, present, and emerging. The Budja on which Murdoch University is located has for thousands of years been a place of learning, and we at Murdoch University are proud to continue this long tradition. So I've just got a little summary here of the 12 perils of pets at Christmas. That's a little bit of a tongue twister that I'm going to talk about today, starting with some environmental perils, like things that dogs can encounter at the beach or in the bush. Some food perils, because obviously our Christmas festivities are usually associated with lots of tasty treats, but some of these can be quite dangerous if eaten by our pets. And last, some trauma and other perils, finishing up with some Christmas tree conundrums. And if you do a little search online about pets and Christmas trees, you'll see some wonderful solutions to these that I'll talk more about later on. For each of the perils that I'll talk about today, I'm going to describe a little bit of why these things are dangerous to our pets. And you'll notice that this talk is heavily weighted about dangers to dogs. And that tends to be because our dog patients are a little bit more adventurous and tend to get themselves in a bit more trouble than cats. Cats most of the time tend to be a little bit sensible, although they can't help themselves with things like tinsel on the Christmas tree, but a lot of the other perils are quite specific to dogs. We'll talk about our approach to treatment, both things that you might need to do when you recognize that your pet has encountered one of these problems before you get to the vet, and then the things that we'll do at the vet for treatment. And most importantly, we'll talk about prevention, because with many of these, prevention is better than cure. Some of the common themes that I'll talk about with each of these perils are that for one reason or another, pets are at increased risk of these problems over Christmas. Some of this is associated with the fact that Christmas is in summertime in Australia, and so there's heat-related and environmental perils that are unique during summer. Some of the increased risk is just associated with the way that we interact with our pets over the holidays. So we might have time off work, which gives us more time for activities with our pets. Usually the weather is good, which makes us want to get out and about. And it's also possible that when we're caught up in the holiday buzz, we're distracted by other things. And so in particular circumstances, like when we're hosting family Christmas, we may be paying a little bit less attention to our pets, which increases the chance that they'll get into trouble without us realizing. Obviously, on the food side of things, we have lots of tasty treats around at Christmas and other unique things like Christmas trees and gifts wrapped up under the tree, which might pose a risk to our pets. All of the perils that I'm talking about today are potentially life-threatening, although vary quite significantly in terms of severity. And so the reason that we're talking about all of these things today is that awareness is really key. If you're aware that these things happen, then you can reduce the likelihood that any of these things happen to your pet. And if in the unfortunate circumstances they do, you'll know what to look out for, and so you can ensure prompt veterinary attention, which gives us the best chance of successfully treating your pet in one of these circumstances. So let's jump right in, and we'll start with pet peril number 1, which is dangers at the beach. Obviously, as Australians, we love going to the beach and bringing our pets along, particularly our dogs. And many dogs enjoy this and things go just fine. But there are various dangers that are worth being aware of, again, so that we can avoid them. Some of these include saltwater toxicity, which happens when dogs ingest or drink large amounts of salt water. This is relatively uncommon, but can cause poisoning and severe neurologic abnormalities. It's also possible that if our pets are swimming in rough water or aren't used to swimming, that drowning is a risk. The beach might also be a place where toxic marine creatures like pufferfish or sea hares wash up, and although they're often quite unpalatable to humans, might be quite exciting to your dog who wants to eat them. Other things that pets might encounter include fish hooks, sometimes with a tasty fish on the end, that our pets might get snagged on or even eat. And sand ingestion, which again doesn't sound particularly tasty, but some dogs will eat large quantities of sand, and then that can get stuck in their intestines and cause quite a significant tummy upset. So the ways that we can avoid some of these dangers are to ensure that our dogs are closely supervised at the beach. Generally, particularly if your pet hasn't been to the beach before, we would recommend keeping dogs on lead where possible so that they can get introduced to this new environment in a safe and supervised way. As they get more exposure to the beach and you trust them a little bit more, you can potentially let them off leash if you're at a dog beach where that's allowed, but really keeping a close eye on them at all times is very important, so that if it does look like they're getting their nose into something that they shouldn't, you can quickly intervene. And some of these things might require veterinary attention if you notice that your dog is having a problem at the beach. Moving on to pet peril number 2, this is dangers in the bush. And particularly I'm talking about dangers of the venomous type, so snake envenomation and tick paralysis. Throughout Australia, snake species are present, and most commonly brown snakes and tiger snakes are seen, although in different areas of the country, all kinds of other venomous snakes might be present, like red-bellied black snakes and death adders. And pretty much all of these snake species are venomous to one degree or another. Paralysis ticks are also a particular problem along the eastern seaboard, and specifically within about 25 kilometres of the coastline. So fortunately here in Western Australia, we don't see paralysis ticks, but all the way along the east coast, these can be a problem. Both snake envenomation and tick paralysis cause paralysis, as the latter name suggests. And this tends to be a progressive thing. So initially the signs can be quite subtle, often starting with a dog just being wobbly in their back legs first. And then over a period of minutes to hours, this can progress to complete paralysis. Ultimately, if left untreated, this paralysis includes the breathing muscles. And so associated with animals not being able to breathe normally, paralysis either from ticks or snakes can be rapidly life-threatening. Fortunately, we do have good treatment options available, both for snake envenomation and tick paralysis, but these are things that we can only do in a veterinary hospital. So for snakes, we have antivenoms available for our different kinds of snakes. And for tick paralysis, we have tick anti-serum available. Giving these products isn't the only component of treatment, although it is usually the life-saving component, but often these patients require intensive care as well as the antivenom or anti-serum, particularly to include breathing support. And in some intensive care units in veterinary hospitals around the country, at any one time, there might be multiple patients on ventilator machines helping them to breathe until they completely recover from the effects of their poisoning. So these are things that we need to take very, very seriously. With regard to prevention, while there's nothing that we can do to 100% remove the risk of these things when our dogs are out and about in Australia, certainly keeping dogs on leash when they're in the bush can help reduce the risk of snake envenomation, although it doesn't necessarily help us with tick paralysis because ticks can be sneaky and can, for example, jump off vegetation as a dog brushes past and then attach to the dog. It's important to be aware that ticks and snakes also make their way into our suburban backyards. And the more undergrowth and shrubbery and leaf material we have in our back gardens, the more these creatures like to inhabit these spaces. And so keeping our gardens clean and tidy, removing any sort of undergrowth and keeping nicely manicured gardens will help reduce these risks. And in tick paralysis areas, it's really important that we take extra precautions. So again, this is within 25 kilometres or so of the eastern coastline. It's really important that dogs and cats, I should say, receive year-round tick prevention. In the last decade or so, some new tick preventative products have come on the market, which do a much better job than the older generations of tick preventatives at reducing the risk of tick paralysis. These include products like NexGard and Brevecto that I've got here on the slide, but there are others available and they can be given in different ways. Sometimes they're given as chewable tablets, sometimes as spot-on products onto the skin. You can also use tick collars, and all of these tick preventatives reduce the risk of ticks attaching and engorging on the dog and injecting their saliva proteins into the dog, which can contribute to the tick paralysis. It's also really important that pets are checked for ticks daily if they're going outside, even if it's just in the backyard in tick paralysis areas, and that you are aware of how to appropriately remove ticks from your pets. This can either be done with tweezers or using special devices for removing ticks. I've included on this site a blog on the RSPCA New South Wales website, which has some really detailed step-by-step information about how to remove ticks from dogs. And it's really important that this is done carefully so that the entire tick, including their mouth parts, is removed to reduce any problems. And ideally, this is done without squashing the tick in the process, because squashing the tick in the process has the potential to inject some of those proteins into the dog at the time. So the tick prevention, checking for ticks and removing them is really important, and also keeping yourself safe. So once the tick is removed from the pet, putting it into a closed container, and sometimes we'll fill a container with alcohol or something like that that will help to kill the tick, is going to be an important part of prevention. So now moving on to the last of our environmental perils, which is heat stroke. And heat stroke is one of those diseases that starts to increase in frequency with pets coming through our emergency rooms starting from about this time of year. And there's a variety of risk factors, both environmental and patient risk factors, that increase the risk of any particular pet developing heat stroke. Again, this is mostly a dog problem rather than a cat problem, because cats tend to seek shade and laze about in hot weather so as to keep calm and avoid overheating. Whereas dogs associated with their enthusiasm tend not to know when to stop and will continue to play or exercise in the heat if left unchecked. So some of the environmental risk factors are obviously the environmental temperatures. So dogs are at risk really on any days over about 30 degrees Celsius, but certainly the hotter it gets, the greater their risk. Lack of access to shade is also a problem, particularly if dogs live outside. So it's important to ensure that they do have access to shade. Exercising in the heat is another risk factor that often we underestimate. So many people like to go running with their dogs, but if you do so in the heat of the day, again, those pets may not know when to stop and may push themselves beyond a safe point and overheat. Obviously, also there's a lot of media about the risks of leaving pets or children in the car. Those areas almost work like an oven with the temperatures increasing rapidly. So even leaving a pet in the car for 5 minutes can risk heat stroke occurring. And this is particularly a scenario where pets might be found dead if they're left in the car for too long. So really important to never leave your pets in the car, particularly not in the heat. With regard to patient factors, I've included a French Bulldog on the slide. French Bulldogs are what we call brachycephalic breeds. So these dogs have a short, sort of squashed nose and upper airway. And this means that they're not able to lose heat from their upper airway like a long-nosed dog, for example. And that puts them at risk of heat stroke. I've also included a black dog to remind us that a black fur coat will trap heat and increase the risk of heat stroke, as will a thick fur coat. Another risk factor is obesity, and certainly if dogs have multiple of these risk factors, that kind of compounds the potential for a problem. The signs of heat stroke are many and varied, and sometimes these can be quite subtle. So it's very important to have an index of suspicion in a pet that has heat exposure, particularly with any of those risk factors. So the symptoms might be as subtle as an anxious appearance, an increase in their breathing rate and effort, particularly with their mouth open. The gums might become bright red as a way to kind of get rid of heat. Excess salivation usually occurs, as does tummy upset. So vomiting can occur quite early on if a pet experiences heat stroke, and then they might progress to the point where they're collapsing or falling down. At the very extremes of heat stroke, neurologic signs can occur, and this might progress to including seizures. So the earlier that we can get pets with signs of heat stroke treated, the less likely we are to see these more severe signs develop. When it comes to treatment, this is one of those areas where pre-hospital treatment can make a really big difference in terms of outcome. It's recommended that as soon as you experience or see early signs of a patient with heat stroke, that you move them to a cool area and that you hose them down with cool water. Ideally, this is just water straight out of the tap. Make sure that what's left in the tap or in the hose is flushed out first before wetting your pet down. But usually this is enough to start to drop their body temperature. If the pet is able to drink, you can give them a little bit of water, although don't force them to drink if they're not able to, because as the symptoms progress, they won't be able to drink normally. And then as soon as they've been hosed down with cool water, you can get them in an air-conditioned car with the fans blowing and get them to the vet. Often when they come to us, even after that initial cooling, their temperature might still be increased. And so we'll do further cooling as needed to get their temperature below about 39 degrees Celsius. And we'll often provide them with intravenous fluids to help us cool them, but also to address any shock or dehydration that might be present. And because of the potential for very serious internal injury, usually hospitalisation with supportive care for a good 12 to 24 hours is required in these patients. With regard to prevention, a lot of common sense prevails here. So avoiding exercising your pets in the heat of the day is going to be very important. And if pets are left outside, ensuring they have access to shade and plenty of access to water is important. But if at all possible, during the heat of the summer, animals should be kept inside in the air conditioning, and this is going to be particularly important for those at-risk patients. So for example, dogs with a black fur coat, overweight animals, or patients with brachycephalic airway disease. It's also important that we're aware and can preemptively do things to reduce risk and increase overall health, as well as reduce the risk for heat stroke. So things like ensuring that our pets are in an ideal body condition. So pets that are obese are at risk of many problems, not just heat stroke. So getting our pets to lose some weight and down to an ideal weight is going to improve their overall health. And for those brachycephalic dogs, the squash nose dogs, that are at risk of developing brachycephalic obstructive airway syndrome, which I've got abbreviated here as BOAS, these patients can undergo surgery on their upper airways, which opens up their narrowed upper airways and allows them to breathe better at all times, including when they're exercising and also getting rid of heat. So all of those things should be done to try to optimize health. Moving on now to some of our food perils, and next is chocolate toxicity. So many people would be aware that chocolate is toxic to dogs. And although you would think that Easter would be a prime time for chocolate toxicity, we actually do see a few more dogs with chocolate toxicity at Christmas time. And I think one of the reasons for this is that often people just don't think that dogs will be able to work out that chocolate is wrapped up under the Christmas tree. But as you're all aware, dogs have an amazing sense of smell. And so wrapping it up is definitely not enough to hide chocolate from our dog patients. And often if you do wrap chocolate up and put it under the tree, you'll very quickly find that present unwrapped and the chocolate half eaten by your furry friends. The risk is greater for dark chocolate than milk chocolate. And all kinds of chocolate contain two stimulant chemicals. Those are caffeine and theobromine. And as a result, the symptoms of chocolate toxicity include what you might expect when they eat a stimulant. So they can have hyperactive behavior, they might start panting. If you feel their chest, you might feel that their heart is kind of bouncing out of their chest. And muscle signs can also be observed, things like muscle tremors or even seizures. And very high doses of chocolate in dogs can be fatal. Obviously, chocolate tastes good to dogs and they don't realise that it's bad for them. And so it's possible for dogs to eat toxic quantities in quite a short period of time, and symptoms can progress within minutes to hours if untreated. When we speak to owners about the risk of chocolate toxicity, we often use chocolate calculators like this one shown on the screen. So these are available online and allow the vet or the nurse to enter in the patient's body weight into the software, the kind of chocolate. So you can see here that I've entered in dark sweet chocolate, recognizing that dark chocolate contains more caffeine and theobromine than milk chocolate. And I've entered an estimated quantity of chocolate in here, so 100 grams for this estimated 8 kilogram dog, and 100 grams would be a standard bar of dark chocolate. So you can see that the software has done some calculations in the lower section and shown us the anticipated outcome. So even 100 grams of dark chocolate for an 8 kilogram dog is potentially associated with a fatal outcome. So cases like this would be very important to get the dog into the vet and cause them to vomit to get as much of the toxin out of the dog system as possible, and then admit them to hospital so that we can treat any symptoms that might arise. So immediate veterinary attention is going to be very important so that we can induce vomiting. A large quantity of chocolate might take some time for the dog to absorb. So the sooner that we can induce vomiting or decontaminate them, as we say, the less likely they are to develop clinical signs. You can see this small dog in the picture has eaten a very large amount of chocolate that we've induced vomiting for, and most of this has come up, which would reduce the likelihood that this pet would develop symptoms. If the pet already has symptoms by the time they come to the veterinary clinic, then we can give specific treatments for those specific symptoms. So there are medications that we can give intravenously to slow down their heart rate. There are others that we can give to stop muscle tremors or seizures. So treatment is very symptomatic and usually requires a good 12 hours in the ICU to manage these symptoms when they occur. So again, prevention is going to be better than cure. Firstly, avoiding chocolate gifts going under the Christmas tree, if at all possible, is important. And this might involve asking people when they're giving you gifts to check that there's not chocolate or any other food in those gifts. And if there is, then making sure that they stay out of reach of pets is very important. And if you do discover that your dog has accidentally ingested chocolate, immediately getting on the phone to a vet to ask about the likelihood of a toxic dose, and or coming down to your local veterinary or emergency clinic as soon as possible is going to be really important. Another thing to consider over the holiday period is that your regular vet might not be open. So knowing what their opening hours are and being prepared with plan B if your local vet is closed, usually that involves a 24-hour emergency clinic, is going to be really important. So when you are in that stressful situation of something having gone wrong, you know exactly where you're going to bring your pet. So moving on to pet peril number 5, and this is artificial sweeteners such as xylitol. So many of you may not have heard the word xylitol, but in emergency veterinary medicine, this is a toxicity that we see very commonly. I think associated with people being health conscious and wanting to reduce their sugar intake, these kinds of artificial sweeteners are used more and more commonly. Originally, they were just used in chewing gums, but now these artificial sweeteners are used for things like butters, including peanut butter, cakes, dessert, toothpaste, and sugar-free candies and lollies. These artificial sweeteners kind of trick the body into thinking that the pet has ingested a large amount of real sugar. And the body's response to ingesting a large amount of real sugar is to release insulin, which causes that sugar to be moved into the cells where it can be used. The problem is with these artificial sweeteners that that same insulin release occurs, but without the presence of sugar. And so this insulin release stimulates a low blood sugar, and that causes symptoms in the pet, including weakness, collapse, and seizures. Another unusual potential consequence of xylitol toxicity is liver failure. We don't quite understand why this happens in dogs, and it can be a little bit delayed after the ingestion of the artificial sweetener, usually by 2 to 4 days. The low blood sugar can usually be treated quite effectively, but the liver failure can be more complex to treat. So again, early treatment is going to be very important. And again, inducing vomiting to get as much of this toxin out of our patient's system as possible is key to a successful outcome. Usually when your pet arrives at the vet after ingesting an artificial sweetener, they'll measure the pet's blood sugar, and if the blood sugar is low, give intravenous glucose so as to boost the blood sugar and prevent any symptoms. And again, if the blood sugar is already low or the pet already has symptoms of toxicity by the time they arrive, hospitalization might be required. And to reduce the risk of liver failure in higher dose ingestions, then the vet might also prescribe a course of a liver protectant medication. And again, in terms of prevention, being aware of what kinds of products contain these artificial sweeteners and avoiding access of your pets is going to be very important. Moving on to pet peril number 6, and this is fatty foods. So our dogs in particular love fatty foods, and there tend to be more of these available around Christmas time, like the lovely Christmas ham shown in this picture. Unfortunately, if dogs normally have quite a stable diet of dog food twice a day, eating a large quantity of fatty foods at Christmas time or at another festive time where dogs might be at a party increases the risk of them developing a condition that we call pancreatitis. Pancreatitis refers to inflammation of the pancreas. The pancreas is an organ that's closely associated with the intestine, and the pancreas normally produces digestive enzymes that are released into the intestine, allowing our food to be digested. Unfortunately, when pancreatitis occurs and the pancreas is overstimulated, these digestive enzymes, rather than being released into the intestine and digesting our food, actually auto-digest the pancreas. The pancreas kind of digests itself. And this causes very significant gastrointestinal upset, symptoms like vomiting, diarrhea, and the pet being off food. And it also causes severe inflammation and pain. So dogs with pancreatitis have a very painful tummy. And in severe cases, this inflammation can lead to organ dysfunction and again, potentially be life-threatening. If a dog is diagnosed with pancreatitis after eating fatty foods, usually they need to be admitted to the hospital for treatment. And this involves things like pain relief, giving them intravenous fluids to make up for any fluid losses through vomiting and diarrhea, and potentially even feeding them via a feeding tube as their gastrointestinal tract recovers. And extended hospital stays of 3 to 5 to 7 days might be required in some cases. So it's very important to avoid the temptation to feed our pets fatty foods at Christmas time. And rather, I would suggest giving our pets chewable toys, like in this picture, rather than treats, particularly if they're not used to those treats, which is often sort of a temptation at Christmas. So we do have to avoid looking into those begging puppy dog eyes when they're asking for a bit of our Christmas ham or our Christmas barbecue, and stick to our pet stable diet during the holiday season, because sometimes just something as simple as feeding a ham bone can land your pet in hospital with pancreatitis. Because we often have family and friends in our homes during the holiday season, it's also important to speak to those family and friends to make sure that they don't feed our pets things that they shouldn't eat. Often it's done out of best intentions, but can result in a very sick pet. And so sort of making some ground rules when guests come into our homes at the holidays can reduce that risk. I've got a few other foods on this slide that I don't have time to go into all of the details, but some things that you may or may not be aware of are toxic to dogs and cats. So bread dough, if eaten raw, can cause toxicity for dogs. Macadamia nuts, moldy things like moldy bread or getting into the rubbish bin, or even blue cheese can be toxic to dogs, as can grapes, raisins and currants, which might be present in festive foods like fruitcake and fruit mince pie. So just avoiding our pets ingesting these things altogether is going to be safest. It's also important to be aware that some plants can be poisonous to our pets. Plants contain many and varied toxins, and again, I don't have time to review all of them today, but some of the ones of particular risk at this time of year are lily flowers, which can cause kidney failure in cats. Lilies are flowering at this time of year and are beautiful, and so often are included in flower arrangements from florists. But it's very important that cats have no access at all to these kinds of flowers. We think that all parts of the plant are toxic, including the pollens, the stems, the flowers, and the leaves. And so these should just not be brought into the house at all if cats are present. A slightly less severe toxin, but also unpleasant, are poinsettia plants. So poinsettias, if eaten by dogs, can cause gastrointestinal upset like vomiting or diarrhea, and so ideally should be kept out of reach of our furry friends. If we do see a veterinary patient that has eaten a poisonous plant, again, usually our approach is to induce vomiting. But for the more serious ingestions like lilies in cats, we may need to admit the pet to the hospital for supportive treatment like intravenous fluids to try to flush the toxin out of the system. So prevention is better than cure, and knowing what plants you have in and around your house at all times is prudent, so that ideally you can avoid toxic plants coming into the house. And that way we can just rest assured that nothing bad is going to happen, because you never quite know when our pets are going to decide to chew on a plant that we have around. Another scenario of dogs eating things that they shouldn't are what we call gastrointestinal foreign bodies. So we use the term foreign bodies to refer to pretty much anything that our dogs and cats might eat that they shouldn't. This includes things like bones, barbecue skewers, and even the tinsel or ornaments off the Christmas tree. These can be problematic because they can get stuck in places that they shouldn't. So they might get stuck in the esophagus shortly after the pet has swallowed them without even making it down into the stomach, or they might get stuck on their way out of the stomach or in the smaller diameter intestines. Foreign bodies can cause problems either because they get stuck, which means nothing can move past them, or if they actually perforate or cause a hole in the stomach or intestines, which can then lead to infection and potentially sepsis. So the sooner that you're aware that your pet ingests something that they shouldn't, the more chance we have of removing that quickly and safely. For things stuck in the esophagus or the stomach, that might include endoscopy, where we put a video endoscope down the stomach into the esophagus or stomach, visualize the foreign body, grab it and remove it, much like if a person was having a scope of their stomach or their colon. But if things are stuck and can't be removed with a scope, or are stuck after the stomach, so in the intestines where we can't reach with our scope, then surgery may be required to remove them. And obviously this is a very major procedure. So if we can avoid our pets ingesting these kinds of things, then it just reduces that risk. So for example, instead of giving our dogs a bone to chew on, there are very safe toys like Kong toys, which can be filled with tasty things like dog kibble or canned dog food that are pretty much indestructible, or at least if dogs do bite off bits, it's only tiny chunks because they're really designed as chew toys. So these things are going to be much safer than bones. Moving on to our last category of perils for pets at Christmas, and now to the category of trauma. So trauma with things like dogs being hit by a car or being involved in fights, either two dogs fighting one another or dogs fighting cats, can occur with increased frequency over the holiday period because often we're bringing our pets into new environments where they might have exposure to other animals for the first time, often in a stressful or kind of hyped up situation. And we might be distracted by the fact that we are the host of a party or having some Christmas conversation and a few drinks, and may not realize that this is going on until it's too late. These kinds of traumatic injuries can be very severe, and both external injuries like wounds can occur, but also internal injuries like broken bones, head trauma, or even internal bleeding. And unfortunately, the externally visible injuries may just be the tip of the iceberg. And so we recommend with any kind of trauma, either being hit by a car or a fight type injury, that veterinary attention should be sought so that the vet can do a full check over of your pet and make sure that we have a full understanding of all of the injuries. With regards to prevention, it may be best to consider leaving our pets at home rather than bringing them into a strange environment with other animals that they haven't met before, because these environments do risk fights occurring. If you do choose to bring your pet into a new environment where there are animals that they haven't encountered before, very closely supervising them is going to be important to make sure that if they do get a little bit aggressive towards one another, so for example, they start growling or showing their teeth, those animals can be separated before a fight occurs, and that will reduce the risk of any kind of trauma. Another trauma that can occur, particularly associated with being out and about with our pets, are oral stick wounds. So sometimes we'll take our dogs to the park or out to the bush and be tempted to throw a stick for our dog. But unfortunately, sticks are not very safe toys for our pets. One of the things that we see commonly in the emergency room is that a dog catches or grabs a stick kind of at a bad angle. And what will happen is that the rough edges of the stick will penetrate the tissues at the back of the throat, and the stick may even move down the back of the neck and cause damage to vital structures. These are very complex traumatic injuries because surgery is usually required to remove fragments of the stick that might break off inside of the dog and repair the damage to these vital structures. So we recommend avoiding throwing sticks at all costs for dogs, and instead throwing safer toys like a ball or a throw toy where that kind of penetrating injury isn't going to occur. And the dogs can still have just as much fun chasing one of these other kinds of toys. Our next peril of the Christmas season is dogs and cats running away from home. And this tends to occur over the holiday season, again, because we might be distracted having parties, people are coming and going from our homes and might leave gates or doors open that otherwise would secure our pets inside our premises. Particularly at New Year's, we also see a lot of lost dogs associated with dogs being startled by fireworks and running away to try and get away from the scary sounds. So it's important to be aware of these risks over the holiday period and ensure that our property is kept secure and that we are aware of where our pets are at all times. It's also very important that our dogs and cats wear ID to maximise the chance of being reunited if they do get lost. So this includes a collar and a name tag, and ideally your phone number, so that if a friendly neighbour does find your pet, they can immediately give you a call and you can go and collect them. And we also recommend having pets microchipped by your veterinarian. So this means that if, for example, the collar and name tag get lost somewhere in the process of the pet being out and about, then the vet can scan your pet for the microchip and identify who the owners are and contact you immediately. And last but not least, I have some Christmas tree conundrums. So many of us like to decorate our homes with Christmas trees and fairy lights and ornaments, which make our houses look beautiful and are particularly enjoyed by our young family members. But Christmas trees can pose conundrums for our pets, including electrocution. If you have a pet that likes to chew on cords, often chewing on the power cords for the fairy lights can occur. Our pets might also be tempted to chew Christmas ornaments that can cause injury to the mouth if they're made of glass, or might cause a blockage if they're ingested. And cats particularly are tempted to chew on the tinsel on Christmas trees, and this can be ingested and again cause a blockage in their stomach or intestine. For those of you that love to have the biggest tree possible, these trees are also a bit of a fall risk. So a dog or cat might get stuck in them and knock them over, and that might cause some trauma as well. So some pets will leave the Christmas tree well alone, but if you do have pets that are very interested by the Christmas tree and you're worried about them getting in trouble, then some creative thinking to minimize these risks is going to be prudent. So this might include something like putting up a fence around the Christmas tree to protect the tree, the pets, and the presents under the tree. It might also include even more creative solutions like having Christmas trees hanging from the roof, or not putting ornaments on the lower half of the Christmas tree where the pets can reach. And if you go online and search protecting Christmas trees from dogs and cats, you'll find some ingenious solutions, although a little unconventional. So it's something to do for a little bit of light entertainment. So we're at the end of my presentation now, but hopefully this has been a good review of the many and varied perils posed to our pets over the holiday period. And just by being aware of these perils will increase the risk that you're able to put some preventative measures in place to try to avoid these occurring. And importantly, making sure you know where to bring your pet if veterinary attention is required, so that prompt veterinary treatment can be initiated, improving the chances of a successful outcome for our pets. So with that, we can take any questions.
That was great. Thank you so much for that, Claire. So we do have a couple of questions here. So the first question is, do you recommend tick searches for dogs even when they're already on topical or oral flea prevention?
I do recommend tick searches, particularly in high risk areas. So some areas tend to be much more prevalent tick habitus than others. And so if you live in a suburb where either you've had a dog or cat with tick paralysis before, you regularly get ticks on yourself, or you've heard of neighbours having dogs or cats with tick paralysis, even if your pet is on tick prevention, then we would recommend daily tick searches. Other areas tend to be a little bit less prone for whatever reason, and so you may get away with just having your pet on tick prevention, but certainly things can change from season to season and year to year. So if your local vet starts, putting media on their Facebook or things like that, that it's a bad tick season, maybe you do need to initiate tick searches in those cases. And a lot of local vets are very good about that kind of education to make owners aware of when we are having a bad tick season. We're lucky that the new preventatives are so effective, but there still have been cases of dogs and cats getting tick paralysis despite being on these newer generation preventatives. So a little bit of searching time while you're sitting on the couch with your pet watching TV in the evening is probably time well spent.
Awesome, that's a great tip. And then another question that has come through. So will cooling an overheated dog need to be staged so that it's not a sudden change, or can they just cool them down straight away as rapidly as possible?
That's a great question. So if you're just cooling a pet, for example, with water out of the hose, it's very unlikely that you would cool them too quickly or too much. We don't recommend doing things like putting ice on a pet or putting them in an ice bath, because that does risk dropping their temperature too much and can cause almost as many problems. But just hosing down with a hose is very safe, usually drying off the biggest bulk of the moisture before popping them in an air-conditioned car and coming to the vet is very safe and will drop their temperature enough to improve their chances of a good outcome without dropping it too much. So yes, it's possible, but just with a hose, that risk is going to be mitigated.
Excellent, thank you. And then another question, and you gave some great tips for dealing with pets and Christmas trees before, and this pet parent is wondering if you have any advice for stopping the cat from climbing and urinating on their Christmas tree.
Oh goodness, cats will be cats, right? I don't have any magical solutions for cats urinating in places that they shouldn't. That can be a very complex behavioural issue that is often quite challenging to resolve. If you go online, some people have done really amazing things with their trees, like putting their entire tree in a display cabinet, for example, so that the pets can't even physically get access, or considering hanging decorations from the roof, or even a tree upside down from the roof so that the animal really can't reach it. Maybe a little extreme, but certainly if your cat has that tendency to not only climb the tree, but also urinate there, you may have to go to one of those lengths. And I think the idea of completely enclosing the Christmas tree or hanging things from the roof may well come in handy for you.
Awesome, that's great. I suspect we'll need to hang our Christmas tree from the roof this year with 3 Labradors and 2 cats. I imagine there'll be mass destruction if we don't. And so we've had one more question come through, and it was in this person's area, there are fireworks that are often present over Christmas, and their dog gets quite scared, and there has been an episode where the dog's escaped before. Any tips on how to deal with dogs and fireworks over the holiday period?
Yeah, this is definitely something that might be worth engaging with your local vet about, because there are some medications that for dogs with very severe noise phobias, particularly to fireworks, they may actually benefit from what we call an anxiolytic medication, which reduces anxiety. One of those drugs is called gabapentin, another is called trazodone. And based on your pet's specific circumstances, your veterinarian may consider prescribing one of those medications. There are other non-medical things that you can do as well. So certainly some pets just need human company around, and just being home with them helps a great deal with their anxiety. Other things that might benefit are what we call a thunder shirt or storm jacket. Thunder Shirt was the original brand that produced these products, and they're basically a very tightly fitting dog jumper, essentially, or dog jacket that can be worn for a dog. And the theory is that they kind of act like a swaddle, like swaddling a baby, And that feeling of kind of being cuddled provides them with some reassurance. So for dogs with very severe storm phobias or firework phobias, doing a combination of these things, so staying at home with your pet when you know there's going to be fireworks, using a thunder shirt, and they can just be purchased online in the appropriate size for your pet, and talking with your veterinarian about whether or not they think medication might be appropriate. Often that combination of strategies can make a really big difference to a pet's experience on New Year's Eve, for example.
Excellent tips. And thank you so much again for all of those questions. Unfortunately, we're out of time today. Thank you again for attending the webinar, and we hope you enjoyed the session. A very special thank you to Claire for putting today's presentation together and for giving up her time to share her knowledge and experience with us. Please remember to register for the next Pause and Learn webinar, Basic First Aid for Pets, with Dr. Alex Hines on February 17th at 7:30 p.m. If you'd like to learn more about Gap Only, PetSure, or the Pause and Learn webinar series, please follow us on social or visit our website. Good evening, pet parents, and thank you very much, Claire.
Thank you.